There you go.
Good afternoon, and thank you for coming out this evening. I would like to discuss with you all the importance of performing a monthly breast exam. Also, the importance of getting your mammogram. It's a typical Monday morning. You're rushing to get to work. You jump in the shower, and you decide, I got enough time. Let me do my monthly breast exam. This is your normally monthly routine. While you're in the shower, as you're doing your breast exam, you notice a lump or a knot. You're a little taken back and alarmed because your doctor has asked you to do this once a month. You have performed this many times and never felt anything. I just turned 40 and I have 3 friends with breast cancer. Today I would like to inform you of the importance of early detection for breast cancer through mammograms. Let me begin by telling you what is a mammogram. A mammogram is a low-density X-ray performed in a radiology center to help get better views of your breast tissue for the purpose of diagnosing breast cancer or any other abnormalities within your breast tissue. It is a series of tests performed by an X-ray machine to get multiple views of your breast at different angles. Why Millions Survive, in the book Why Millions Survive Cancer, and by the American Association of Cancer, recommends annual mammograms for women at about the age of 40 to have it done yearly. This study detects abnormalities within the breast and helps to detect breast cancer at its early stages. In special cases, such as genetic dispositions, mammograms are asked to be done as early as the age of 16. In the United Kingdom, a case was reported as early as a 10-year-old child with breast cancer. The CDC has guidelines on doing your monthly breast exam. For women, this is a picture of a woman's monthly breast exam. It also has pictures of how to perform it laying down or standing up. But contrary to popular belief, there's also instructions for men to give the breast exam as well. Yes, I said men. Men should do a breast exam once a month as well. Now, you wonder, men, why a man? Men are just as susceptible to breast cancer as women due to they have fatty tissue in their breast area as well. Now, you wonder, we've heard about mammograms many a time, but how is a mammogram actually performed? Well, I told you that it's done in a radiology center, so it's not like getting a chest x-ray. It's a little different. For women, it's a plate that sits up on a machine. It flattens the breast in different angles to take the pictures to get within the density of the breast. Some women who have larger breasts or implants need additional views taken and also may require to have an ultrasound done later on so that the radiologist can properly diagnose a woman. And I say implants, meaning the breast reduction, breast enlargement, and breast reduction due to scar tissue. This entire procedure should only take about 20 minutes in total. Now that we know how breast exams are performed, let me tell you why and who the demographic is more specific to in terms of who should have the mammogram. Women should be aware of their family history with their mother's history, their sisters, and their aunts as well. This will help you to give a genetic history of your family, so in case you may need, again, that predisposition, or in case it's a family history of it, you can be tested early. By having a mammogram regularly, you minimize the risk of cancer by 35%. That's 35% out of 100 just by going once a year to have your monthly mammogram. Unfortunately, mammograms are not perfect. Physicians still encourage you to continue doing your monthly mammogram. So again, I said earlier, contrary to popular belief, men are also at risk for breast cancer. Men have fatty tissue in their breast area as well. Breast cancer for men are some also called pigment, that's PAGET cancer. It's due to, a variety of cancers, some variety of cancers in men and women are associated with obesity. It is not restricted to obesity, but it is one of the leading causes for multiple types of breast cancer. In 2015, it is estimated that 400 men will be diagnosed with breast cancer in the United States alone. Given the diversity of the population affected by breast cancer, mammograms again are the first step in effectively diagnosing breast cancer. Cancer is a ruthless monster with no concern to who it attacks or who it invades. Every year, just think of this number. Every year, 1 in 8 of your Facebook friends will be diagnosed with breast cancer. 1 in 8. Another number that is kind of shocking is that over 2,000 women will be diagnosed with breast cancer in 2015 alone. It is now November of 2015. Over 40,000 women will die of breast cancer this year alone. Caucasian women are more susceptible to getting breast cancer than African American women. However, African American women will be more likely to die of breast cancer than Caucasian women due to a lack of education and resources. This is why I recommend for women and men alike to perform their monthly breast exam. For women at the age of 40 and above, so please get your yearly mammogram. Thank you for coming out today.